In an earlier presentation, I talked about the use of adhesive dentistry techniques to reattach fractured tooth fragments. Today, we will discuss using those same techniques for splinting of teeth that have been displaced from the tooth socket. Avulsion refers to a tooth that is completely removed from the socket. Luxation injuries are where the tooth is displaced but not completely lost from the socket. This can be in any direction, laterally, buccal or lingually, as well as intruded or extruded. Finally, subluxation injuries refer to those injuries where a tooth is loose but has remained in the normal position in the tooth socket. When an object strikes a tooth, energy is transferred to the tooth, often resulting in a fracture of the crown or root. Energy can also be transferred to the supporting tissues, specifically damaging the periodontal ligament, the cementum of the tooth, and quite often the alveolar bone. Application of a splint allows the torn or stretched periodontal ligaments to properly repair. Rather than a comprehensive look at treating these injuries, today we will focus on the techniques used in applying a splint to these teeth. Studies have shown that teeth that have sustained these type of injuries can often heal without splinting. However, there are good reasons to apply a splint. Teeth that have been avulsed or teeth that have extensive mobility after being repositioned should be splinted to minimize the possibility of additional injury to the cementum or periodontal ligament. Also, even teeth with minimal mobility often require splinting because patients will find it relieves the discomfort associated with the trauma. Another consideration, from a very practical standpoint, is that splinting will often eliminate the chances that a patient might displace the tooth again and possibly swallow or aspirate the tooth. The American Association of Pediatric Dentistry has outlined these 8 features that they consider important for a good splint. Of particular importance is that the splint be passive and that it allow for natural tooth movement. To be passive, the splinting material must be adapted to the arch form of the teeth. If it is not, it will cause pressure on the teeth similar to orthodontic forces. In addition to possibly moving the teeth, an improperly applied splint can cause additional injury to the traumatized tooth. A splint also needs to be non-rigid and allow slight movement of the teeth. Although most splints are not left in place for more than 7 days, ankylosis of the splinted teeth can occur if the ligaments are not allowed to stretch and compress normally. This is an example of a splint placed on a typodont. In a situation such as this, one of the central incisors would have been injured. I will review specific techniques in the live presentation, but you can see here that the wire splint is held in place by composite resin that has been bonded to the facial surfaces of the teeth. The process would be to isolate the area from moisture as you would normally do for adhesive procedures, including preventing any blood from the gingival sulcus or other injuries such as a lacerated lip or cheek from contaminating the area. The wire that is used must be adapted to the contour of the teeth so that it fits passively across the facial surfaces. An alternative would be to use a dead soft wire or other material that has no resiliency, so that it will remain positioned without a tendency to return to its original position. Once you have isolated the area, acid etch is applied to a small area on the facial surfaces of the teeth to be splinted. This is rinsed and dried before applying the bonding agent. Once this area is prepared, the wire is carefully placed over these bonded areas and luted to the tooth with a bead of composite resin. Finally, let's review some key points regarding splinting. As I mentioned, it's not always necessary to put a splint on a displaced tooth or a loosened tooth, but we should consider splinting when we want to prevent further injury to the tooth or if we want to secure a very loose tooth in the socket. Another reason for applying a splint is that oftentimes patients will find that it makes the injured tooth more comfortable. Since we are using adhesive dentistry techniques, having a well-isolated dry field is a must. Splints are generally left in place for 7 days, unless there is significant mobility. Also, if patient discomfort warrants it, the splint can be left for longer periods. It is critical that patients have excellent oral hygiene in the area of the splint, and the use of chlorhexidine will aid in the healing of soft tissue injuries. Other points to keep in mind is that patients with a splint should consume a soft diet and avoid eating in the area of the splint. Patients should also be instructed to call immediately if the splint breaks or loosens so that it can be repaired. In the live presentation, we will review splinting in more detail and take a closer look at some of the materials that can be used.